In a busy city like Ottawa, it would be hard to guess that 1 in 5 Canadians suffer from a mental illness. The stigma associated with it makes it hard to seek treatment and talk about it openly. 30-year-old Ottawa resident Tommy Jaworski was diagnosed with catatonia 10 years ago, a severe type of mental illness that makes him rigid, stiff, and comatose. When these symptoms first came on in late 2005, his mother Zeno says he had to be hospitalized for weeks. After trying and failing to treat Tommy using conventional methods like medication, Tommy's psychiatrist Dr. Ribeiro suggested electroconvulsive therapy, sometimes referred to as electroshock therapy, or ECT. ECT is a procedure performed under general anesthesia in which a machine sends small electric currents through the brain to intentionally trigger a brief therapeutic seizure. The treatment is extremely effective for patients suffering from severe mental illness for whom medication alone is not enough. But despite its effectiveness, ECT is underutilized in Canada, and more work still needs to be done to ensure that it is delivered safely and consistently. To this end, a group of Canadian ECT practitioners have banded together to develop a set of national guidelines that they hope will ultimately improve the quality and effectiveness of ECT in order to make it a more generally accepted treatment. The guidelines will cover everything from training, dosing, equipment quality, and accessibility. Tommy's psychiatrist, Dr. Ribeiro, is one of the doctors involved. He is in charge of the training component. He says the goal is to eventually have transparent, high-quality ECT for all Canadians who need it. With ECT, Zeno says that Tommy can at least have a quality of life that he can enjoy.
Anytime I'm asked to talk to any patient about ECT, I do it with a positive attitude because I have my son for it. And I really wouldn't have it without it. Do I want to do that for the rest of his life? No. I wish there were something that we could do different. But I can't call it an option. It's the only way he's here.
Zeno is hopeful that the impending guidelines, which are expected to come into force in the new year, will help make ECT more accessible to patients like Tommy who really need it.